So my final question, let's kind of end it on a good note. So I know, ILD is a tough field. I mean, you guys are dealing with a lot of things that are difficult to treat, where it's difficult to talk to the patient, difficult to measure success. But I wanted to ask you of the good news in the field. Like where do you see things, there's some excitement around the corner or good things have happened, or what do you see as successes in your daily practice? Do you see things that are reversible, not necessarily IPF, but other things, that gives you joy in terms of, I really made a difference to this patient. I, I reversed something or treated something and made a significant, something that you can see as a win both for yourself and the patient. How do you see that?
Yeah, I think that for one thing, we have treatment now, right? Like we didn't have any treatment prior to 2014, right? So at least we can offer them something,
Right.
right? Um, you know, sometimes there's not sometimes, always there's value in helping patients navigate the journey, right?
Right.
And that's rewarding, finding and forming these relationships with the patients as they go through the journey. And you know, our role is to help them navigate all that, whether it's transplant, if that's an option or not. I got a card from one of my former patients who just hit her fifth transplant anniversary, right? Which
Wow.
is a big deal in the
Yes.
lung transplant world. And she went to Philly to do a family reunion and climb the Rocky Steps and had her, hands in boxing gloves and did one of these in front of Rocky and like
Yeah. Yeah.
that's a win as far as
Yes.
I'm concerned, right?
Yeah.
Uh,
Absolutely. Yeah.
I think that we are getting smarter, with machine learning, things like that. People are focused on these diseases. They know they're hard to diagnose. They know that the time to diagnosis is too long, and people are trying to develop ways to shorten that time to diagnosis and to help standardize the ways that people are reading CT scans. And I imagine there are similar things for biopsy specimens to sort of make sure that you all agree what you see as UIP is UIP. And so I think that people are aware. There is a consciousness to this that leads me to some hope and belief that we will make progress, over the course of my career and afterwards.